We're going to discuss about viral STIs. As we discussed earlier was bacterial STIs, and now we're going to talk about all the viral STIs. So as I always like to introduce, what we're going to be discussing is going to be herpes, cytomegalovirus, HPV, hepatitis A, B, and C, and HIV. And I promise we can get through this, and I know it's a big map, and there's so much we have to get through. We can do this. The reportable ones are HIV, Hep, and hepatitis. So don't forget that. And HIV is HIV, Hep A, and Hep B. And Hep B, which in perinatal, is 1 work day. Hepatitis B and C is 1 week. All right, hepatitis A and HIV are the main ones to think about in 1 day. B and C is 1 week. It's only B when it's perinatal that it's 1 day. Okay? All right, so the first one we're gonna be discussing is about herpes. All right, so as I like to go through, we're gonna go through the causes, and then we're gonna go through the clinical manifestations, our diagnostics, our fetal complications, our complications, and then our interventions. All right, so our causes of herpes we're going to think about our herpes simplex virus 1 and our herpes simplex virus 2. So herpes 2 is more associated with our STIs, but now they both can happen in genital and oropharynx, but herpes 2 is associated with your STIs. This is a reminder. So herpes 1 is more associated with oral, and herpes 2 is more associated with genital herpes, but now because of like oral sex and stuff like that, they could also be vice versa. All right, so it can be transferred through kissing, sexual contact, sharing food, eating utensils, cosmetics, and bath items. So not easily killed. So you think, oh, I'm gonna share her eyeliner. Can I please use it? Thank you. And then you're just like, no way can you share. So when your mother told you don't share eyeliner, she meant it. Have I done that before? Yeah, I definitely done that. I've done that before. Okay, confessions to make. I have definitely shared eyeliner before, and that was a very no-no. So don't do it. And don't share utensils. I've done that before. Okay, so whatever. So now we know that's why we need to educate ourselves, is because there's so many things that adolescents do and they're not educated. All right, so the transmission enters through mucous membranes, breaks in the skin during contact with an infected person. That could be symptomatic, asymptomatic, and it's also spreads through viral shedding, so you don't have to have symptoms in order to spread the infection. That is the main thing I would take away from this. And it enters through nerve endings, so remember that. All right, so for clinical manifestations, it can be symptomatic, remember that. The primary episode is going to have painful sores that last 17 to 20 days. So you may have painful sores around your mouth or down below or whatever, but remember they're painful and they last 17 to 20 days. They're gonna have a burning, itching, tingling at the site of inoculation, multiple vesicles that are painless lesions. So I can tell you the different sites that this painful lesions can happen. The inner thigh, the penis, the scrotum. So we're thinking of guys now. Vulva, perineum, perianal area, that's a woman. More associated, vaginal or cervix. So these can happen in multiple areas, and they can be asymptomatic as well. The vesicles contain large quantities of infection viral particles. Lesions rupture and form shallow, moist ulcerations that finally crust and heal. Pain, fever, headache, malaise, myalgia, regional lymphadenopathy with primary lesions that last 17 to 20 days. So remember that, because the secondary, it will be quicker healing. Okay, so fever and malaise, they have these painful lesions and they last about 17 to 20 days. Or they could just be asymptomatic and never develop it at all. So also with these recurrent episodes, they occur in 50 to 80% in the first year for patients. So 50 to 80% experience these when they have herpes. The triggers can be stress, fatigue, sunburns, general illness, immunosuppression, and menses, your period. Blame the woman. All right, so prodromal is just a term they use for may note pain down the leg, tingling, burning, and itching prior to lesion. So even down the leg, they have this tingling, burning, and itching like prior to even the lesion showing up. So let's say the person looked like me, and then they feel something, and then it pops up in like a week. So the lesions are less severe than the initial. They heal faster, 8 to 12 days instead. And urethritis is also known associated with this because if they have lesions in their genital areas and also urethritis is just the concept of inflammation. I was thinking of burning. So the diagnostics to think about is viral culture for this, culture of the blister, and serologic test. So these, you can use a viral culture, you can use a serologic test. This is how it's going to be diagnosed, herpes. Okay. All right, so the complications is the next thing we're going to talk about. So the complications, it can be auto-inoculated from fingers to lips. So you could like touch down there or whatever, and then you can go up here and then you just spread it to yourself. So if that makes sense, or vice versa. All right, so it's more susceptible to, you become more susceptible to HIV and if they have HIV, you may be able to tell because they may have more recurrent infections when they're really supposed to go less and less as time goes on. They become more and more and more, and you're just like, why are they getting more recurrent infections instead of less? So that could be a sign of HIV. Just remember that. So the auto-inoculation, and then aseptic meningitis and lower motor neuron damage. This can happen. So aseptic meningitis and lower motor neuron damage. Neuron damage, atonic bladder, impotence, and constipation. So these are further complications that can happen. So this aseptic meningitis, remember it, the lower motor neuron damage, which they're talking about the atonic bladder, impotence, which is not being infertile, and constipation. Okay, so our fetal complications are vertical transmission to the neonate. So if herpes lesions present, you're going to recommend a C-section. And also 36 weeks into pregnancy, administer given acyclovir to prevent neonatal transmission. So if they're like, it depends if they have genital herpes actually there, if they can have a regular pregnancy. But if there's genital herpes lesions there, they have to have a C-section to prevent this. And they may be able to be breastfed. It really just depends if the lesions are present on their nipples or not. So yeah. Neonatal herpes is fatal, so acyclovir is recommended to the mothers, especially in that 36 week. Okay, so we talked about everything except for the interventions when it comes to herpes. Okay, so herpes, you're going to want to get, so because of this painful urination, you can void in a tub of water. So that would make it less hurt. So literally you just sit in a tub of water, like think about peeing in the pool. That's basically what it's like. They may be given lidocaine, codeine, or aspirin into, this is just a local anesthetic, or codeine is a narcotic, and aspirin is also pain medication, so non-narcotic pain. So these are pharmacological factors to reduce that pain. For patients that may not have lesions, but they still want to have sex, recommend condoms because it's recommended for all contact. The reason is this is the only protection there is out there. All right, so oral acyclovir is the only one because the ointment is not effective. So the dosage and length is determined by the initial and recurrent and suppressive therapy. It shortens the duration of the viral shedding and healing time of the genital lesions and reduces side effects. But the side effects are headache, nausea, vomiting, and diarrhea, which is pretty common side effect to think about. So basically, it shortens the duration of viral shedding and increases that healing time. But it's not a cure. The main thing is that partners should be evaluated and treated for symptoms, so it's symptomatic. Good genital hygiene is really, 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 really important. Teach them to have a loose-fitting cotton underwear because they'll have genital lesions. Keeping the lesions clean and dry is really, really, really important. And cool, remember a blow dryer could be used to dry the area, so cool setting. Remember, cool setting. Hot would not be a good idea at all. A sitz bath, warm bath, and help. This is more for comfort. Drying agents, there's a colloidal ointment and aluminum salts are drying agents for herpes to keep that area dry so there's not a big bacterial party because, moist environments, bacteria love it. So, yeah, that's everything for herpes. All right, so now we're going to talk about HPV. All right, so the causes of HPV, the incubation period of HPV, and this one's like the most common viral infection. It's human papillovirus. That's when we think of our warts type. So the causes is called human papillovirus. It has 100 different types. It's 90% 6 through 11. So that's most of them are a certain brand. All right, so there's minor abrasions during intercourse. It allows HPV to enter. So that's basically what the definition of an STI is. And the last thing to know is 3 to 4 months incubation period. So these people could be infected with the HPV and you don't even know it because it was like not there, like the signs and symptoms, and then you just had sex with them. Shit. Okay, so that's not a good idea. So you may not even know you have it, which is really scary. All right, so now let's talk about the clinical manifestations of human papillovirus. So it's often, there could be none present and you're just spreading the infection to everybody. So yay, not awesome. Okay, it's discrete single multiple papillary growths if there is symptoms, white, gray to pink flesh colored, whatever color your skin is basically what the warts per se on the genitals are gonna look like, kind of look like cauliflower maybe is a way to put it. They may grow and coalesce and form large cauliflower-like masses, so if they like grow together, they don't look pretty. So please, if abstinence is possible, or just having one partner for like the rest of your life, may be a good idea. 1 to 10 warts on the penis, the scrotum, the anus, or urethra in men. So woman, it would be in the inner thigh, so it can even be on the inner thigh, not even necessarily that area. The vulva, the vagina, cervix, or perianal. And if it's in the cervix, you may not see it, so that's scary. Okay, so those are the signs and symptoms. So I think of warts a lot when it comes to human papillovirus. I'm trying to look for diagnostics now. All right, so the diagnostics we're gonna wanna have is gross appearance. Honestly, for the lesions, you're gonna be able to tell, but you definitely wanna still get a diagnostic testing of serologic or cytologic testing and a pap smear because this one is associated with cancer. So pap smear for cancer, think pap smear, gotta have your pap smear. All right, complications are cervical the most common type of cancer, but type 16 or 18 are oncogenic, cervical, vaginal, vulvar, anal, and penile cancer. So men and women out there, they're both can get cancer, okay? And it just depends on the strand, but you wanna stay protected. All right, so the fetus complications 6 and 11 cause RSP papillomatosis. Just know there's fetal complications. All right, so now the interventions. Cryotherapy, it just means basically you're gonna freeze it off your penis, but remember, don't use over-the-counter medications because that's not the same thing. And those patients may try to freeze it off because it looks so ugly and they don't wanna tell their parents. Don't do that, go to the healthcare provider. Oral acyclovir, because oral is the only one that is effective. There's a chemical, so that's just to help lessen the viral shedding. No, viral shedding was associated with herpes. Chemical or ablation, but it'll help the healing. Maybe it may help, it may not help. It just kind of depends. Chemical or ablation of warts that may last 16 weeks. Yeah, that's other than the cryptotherapy. What is So OTC should not be used. Podophylix is a gel or cream, 3 days and 4 days off in a 4 cycles. So that's a cream they use. So 3 days on, 4 days off, but in 4 cycles. So 3 days on, 4 days off, 4 times. So this is like a cycle that they use for podophylix is what they put. I always think of like a penis with a lot of warts on it. It's really, okay. Over-the-counter medication should not be used. Okay, so now let's talk about, there's vaccines out there, and I even took one, a Gardasil shot, I remember. So during vaccination, make sure that the patient is seated or lying down and watch for 15 minutes after, because this is associated with syncope, which is, syncope is a word used for dizziness. So type 6, 11, 16, and 18 is for Gardasil. And type 16 and 18 is called Cervarix. So these are 2 different vaccines, Cervarix and Gardasil. and they protect against 2 different types of strands. Now, if the patient is already infected, they can't protect themselves against that specific strand that they have, but they could still take the immunization shot and be protected against the other strands that there are out there. All right, so let's talk about HIV. All right, so HIV, the cause is a human immunodeficiency virus. So that basically explains it within itself. So the transmission, contact with infected blood products, that's the transmission. It's the 6th leading cause of death in women 25 to 36. So like that's like way up there with the cardiovascular diseases and diabetes and all that stuff. It causes acquired immunodeficiency syndrome, which is basically in the name itself. The transmission is sexual contact with infected body fluids. It can also be transferred from infected mother to child during pregnancy, childbirth, and breastfeeding. So breastfeeding, wow, that's not good. So like with herpes, it just said if you don't have lesions on your nipples, then it's fine to breastfeed, but this one could infect through breastfeeding. Okay, so now let's talk about the clinical manifestations. There are 3 stages, similar to when we think about syphilis has 4 stages. Well, this one has 3 stages. There's an initial stage, so flu-like may occur in 2 to 4 weeks after the infection, so they feel like they have a flu. There's an asymptomatic period, and that they just don't have symptoms at all. And then there's symptomatic period where they're gonna have white spots on the mouth, throat, and tongue, which is the chronic yeast infection. So these white spots on the mouth, the throat, and the tongue, so that's all in this area. That can be sign for chronic yeast infection, weight loss, fever, fatigue, night sweats, dry cough, depression and memory loss, diarrhea, and swollen glands. This is known for the symptomatic periods. All stages are contagious, so y'all know, even the asymptomatic. The end stage, the immune system severely damaged, and opportunistic infections develop, plus cancer. So this stage of end stage is basically associated with the immune system. That's where the death really happens. It's more usually something else kills them. It's just the depression of the immune system is what really causes the real death. And some opportunistic infection usually happens. All right, so now let's talk about complications. No, let's talk about diagnostics, and then we can talk about complications. So there is a screening, but this is not going to be, you can't diagnose through screening, but the first thing is there's an HIV rapid antibody test to get just like to know if they have it and like if they have a sign, and then to really be diagnosed with HIV, immunodeficiency virus, you're going to diagnose with a Western blot or a ELISA testing. So Western blot or ELISA testing is the only way to officially diagnose, which the physicians do. All right, so the complication is more associated with just, we talk about the fetal complications with the vertical transmissions. So if it's untreated during pregnancy, 15 to 25% babies will contract HIV, and taking an antiretroviral like acyclovir will decrease this chance for the baby by, to make it decreases to 2%. So definitely encourage those mothers to take a cyclovir, oral cyclovir. There really is no treatment for this, but notify and treat all partners with like help, support, be supportive, I guess, and give them an oral cyclovir, but there's not really much you can do. So there's no treatment, only management. Medications help kind of prevent infections, but it just basically oral cyclovir inhibits the viral replication, but it's still going to be in your cells. So it's terrible. All right, let's talk about cytomegalovirus now, because after cytomegalovirus, then we can talk about the hepatitis, which is like one of the biggest ones I have. All right, so cytomegalovirus is, the cause is from cytomegalovirus. Pretty easy. The transmission can be urine, saliva, blood, cervical secretions, and semen. All right. Clinical manifestations, it may look like mono, so yeah. Just may look like that. Malaise and myalgia, like muscle weakness, not feeling good, tired, you know. The patient may have fever and chills, lymphoadenopathy. That's where the microorganisms are draining into the lymph nodes. And so how are we going to diagnose this? So there's a presence of cytomegalovirus, Pacific IgM. So there's a Pacific cytomegalovirus immunoglobulin, basically IgM, and increases in IgG titers. All right. So this is what they're going to see as the titers. So they're looking for those antigens. And there's no vaccine for cytomegalovirus. So that's really all there is for that, for cytomegalovirus. Now let's talk about hepatitis A, B, and C. And remember, HIV and hepatitis A are the ones you're going to be reported. Hepatitis B only in perinatal, and hepatitis B and C are so when I was saying perinatal, I mean HIV and hepatitis B, no, HIV and hepatitis A and B only in perinatal are reported in one day. Hepatitis B and C are reported in 1 week. Okay. So the causes, they're all associated. Hepatitis A, B, and C are associated with virus, but basically it's saying hepatitis, the cause, it's basically saying the cause is from a virus. So causes are all viruses, but they differ in their transmission routes. So they have similar clinical manifestations, but they can be contracted a little bit different ways. So the A is a fecal-oral contact. It may also occur in contaminated food or water is ingested. So basically, that's the one with fecal-oral. That's the one where you get the vaccine for out of country with hepatitis A. Hepatitis B is vertical to neonate. This can be transferred, sexual contact, injected, drug sharing, toothbrushes, razors, needle sticks, exposure to infected blood or open sores can be chronic. So this one is associated with more extra like things to think about, like your toothbrush, your drug sharing, your razors, your needle sticks. Really important to think about. Your hepatitis C is blood and IV drug use. Sexual transmission is low. Patients seeking STI treatment should be screened, and vertical to neonate. So they're similar, B and C. All right, so the diagnostic is a serology. You're looking for those antigens when it comes to hepatitis A, B, and C. Our clinical manifestations are going to look like hepatitis, basically. So we're going to see pruritus, itchy skin, think your salts in your bile. You're going to see the dark urine. You're going to see that clay-colored bowel movement. You're going to see fever, loss of appetite, abdominal pain, nausea and vomiting, fatigue, joint pain, and jaundice. So basically, these are the symptoms, the signs and symptoms that you usually see in hepatitis. So like liver damage. So it's really attacking your liver, and that's what we're thinking about here. Our complications, our two main ones are associated with liver as well, cirrhosis and liver damage. Cirrhosis is liver damage and liver cancer as well. All right, the last thing I want to talk about is the interventions associated with this and also how to protect yourself as a healthcare provider or healthcare worker in general, nurses, doctors, respiratory therapists, whatever it is, whoever's taking care. So main things to do is, okay, so if they have hepatitis A, B, or C, just to always wash your hands because A is associated with fecal-oral contamination. Supportive rest diet, high carb, low calories, high calories. Rest diet, high carb and calories, but remember that there has to be high carbs, moderate fat, and protein because you have liver damage, so you don't want to have too much protein. That can hurt it. Avoid medications that are metabolized in the liver. Why? Because we are having liver damage, and a lot of medications are associated with liver because they're metabolized in the liver, so that makes sense. They're not hospitalized just because of this, but if they have dehydration, that's when you bring them to the hospital. C and B are the only ones that they are given in medication. It's basically similar ones: interferon, ribavirin, interferon, tenofovir, lemivimidine. If they have hepatitis B, administer them hepatitis B immunoglobulins, and to the partner because the hep B like immunoglobulin to be protected against their partner, especially if they're having intercourse. There's a vaccine for hepatitis A for out of country, and there's a lot of teaching that goes on to like teach them to avoid over-the-counter medications like acetaminophen, avoid alcohol, which causes liver damage. We know that. Rest frequently throughout the day, rest through the night. Eat small, frequent meals high in carbs with moderate fat and moderate protein, as we discussed earlier with nutrition. If they're infected, they're not allowed to donate. Do not donate. Make sure they know they don't waste their time in line because they can't donate blood products. Avoid sexual intercourse until antibody retesting is negative. And then healthcare workers. The main things I would say is anybody, this is including anybody, drink treated water if you go out of country, because hepatitis A was associated with that. And standard precautions for healthcare providers to protect themselves with the needleless system. That is everything that I have. So for post-exposure to Hep A, seek immediate help for immunoglobulin administration is also important. So that's everything for hepatitis A, B, and C. The ones we have talked about was herpes, cytomegalovirus, hepatitis A, B, and C, HIV, and HPV. The ones that we're going to report, again, just going to remind you, is HIV and hepatitis A are the ones you report in one day. And also, in addition, you report hepatitis B perinatal in one day. And then hepatitis B and C is within 1 week. So that's everything. And happy studying and good luck, everyone. So you can do it.